The great resignation has hit healthcare hard, and it's hit Baystate hard as well. I believe about 1 in 5 folks in the healthcare space have left the field since the beginning of the pandemic. And for us, that has showed up as roughly 1,500 open positions among our 13,000 employees. And we have critical vacancies in pretty much all the frontline roles. We've made up for this by hiring some very expensive contract labor in order to keep our doors open. And that has caused us to be running at a significant deficit and to drain our financial reserves. We've already done some significant reductions in force in the back office functions and at the executive level. Of course, we can't do that at the front line because we're already short there. We're looking at a number of other financial improvement strategies and unfortunately are looking at what are those services where somebody else might be able to step in if we didn't do it. There are a number of services where we're the only provider for a very large service area, so those have also been pretty much out of bounds. 70% of our payers are governmental payers, Medicare and Medicaid, and we pretty much will take whatever they give us because that's the way it goes. And here in Massachusetts, commercial price increases are governed by a state agency called the Health Policy Commission, which typically caps rates of rise at about 3%. And that obviously doesn't compare favorably to our inflation rates, which are close to 10%. Really, all of our financial problems go back to the issue that not enough people are coming to work in healthcare these days. And so, if there were a broad based national program to really push loan forgiveness, training programs, onboarding programs, outreach to populations that typically didn't think about healthcare, that would go a long way to addressing some of the issues. I would say of the financial variances that we've been dealing with, 3/4 of them tie back to labor issues.